Hi, it's Dr. Lynise Anderson here at the Healing Tree Wellness Center, and today I'm here to talk to you about male obesity. It's no secret that overweight and obesity are big problems in America. At present, 2/3 of all Americans need to lose weight, and the number of overweight children and adults is growing at an alarming rate. Obesity affects men and women about equally, but if you're obese, you're at a higher risk for developing many adverse health conditions: gallbladder disease, gallstones, liver diseases, type 2 diabetes, gout, osteoarthritis, certain types of cancers, heart disease, stroke, sleep apnea, high blood pressure, and that's just the tip of the iceberg. Forget the cosmetic factor. Obesity is disastrous to health. Men rarely worry about their weight, and with a more carefree attitude are more likely to eat what they want without paying heed to daily intake or long-term consequences. Even if they are overweight and they know it's bad for them, men will rarely take steps to overcome obesity until they get a wake-up call in the form of a diagnosis of diabetes or worse, a heart attack. Since men are the primary breadwinners in most households, they bear the weight of worrying about project deadlines, promotion, the mortgage, bills, and the financial future and well-being of their families. Such high levels of stress and demanding schedules can make even 10 minutes of exercise a day seem like a daunting task. Add to that the responsibility of making healthy food choices through the day, and most men would rather not bother at all. Additionally, society and the media have always focused more on women looking good and maintaining their weight. So, men rarely have any motivation to watch their weight. While overweight and obesity affect men and women in equal numbers, they take a special toll on male hormones, sexuality, and prostate health. Simply stated, obesity lowers testosterone levels. A study of over 1,600 men ages 40 and above found that each 1-point increase in body mass index was associated with a 2% decrease in testosterone. Another study of men ages 30 and above found that waist circumference was an even stronger predictor of low testosterone levels than BMI. A 4-inch increase in waist size increased a man's odds of having low testosterone levels by 75%. By comparison, 10 years of aging increased the odds only by 36%. Although men with erectile dysfunction often blame testosterone, hormonal issues account for only 3% of ED. One study reporting that having a BMI of 28, which is overweight but not obese, increased a man's odds of developing erectile dysfunction by over 90%. Benign prostatic hyperplasia, or BPH, becomes more common as men get older. It also becomes more common as men gain girth. A study of over 25,000 men found that waist circumference was strongly associated with a man's risk of developing BPH symptoms. Ultrasounds and MRIs have been used to measure the prostate gland, and the findings are in. Men with bigger bellies have bigger prostates. Oddly enough, while obesity seems to result in a larger prostate, it also lowers PSA. While this may indeed sound like good news, think again. Studies found that PSA levels were lower not because their process produced less of the antigen, but because obesity increases blood volume, so the PSA level is more diluted in the blood. Because obesity lowers PSA levels, it can actually make it harder for doctors to use PSA measurements to detect prostate cancer in overweight men. In today's America, unfortunately, being overweight is the norm, but it's not normal. In fact, this common problem is one of the things that makes diabetes, high blood pressure, heart disease, and arthritis so common. And if that's not bad enough, it also increases your risk of other male maladies like erectile dysfunction and BPH or prostate cancer. Take heart in the fact that it's never too late to begin your fight against obesity. A few small steps starting today can help to ensure a longer, healthier life and something that's more fulfilling. Good health is not a struggle, and it's not an extraordinary feat. Healthy living is about understanding what your body needs and what's good for you. It's the manly thing to do, and the time to start is now. So when it comes to improving your health, don't wait. This is Dr. Lynise Anderson from the Healing Tree Wellness Center, wishing you healthy habits and a healthy life.